questions for us to begin with. So Kirby, you're on first.
Okay, hold on 1 second. All right. Well, like Debbie said, welcome everyone to the Region 5 Planning and Policy Council meeting. Thanks for your flexibility this morning. We switched to a new format. Just a few things. As you know, Governor Lee's executive order has not been extended, but the council determined that it's necessary to meet electronically due to the continuation of the COVID-19 pandemic and the need to ensure a safe and healthy meeting environment. So we are meeting electronically via the Open Meetings Act. With that being said, these meetings are still being recorded and it will be posted to the department website within the next day or two. So if you're not speaking or presenting, please make sure your phone or your computer is muted to prevent any feedback. And if you are presenting or asking a question or commenting, please state your name. It's helpful when capturing the minutes. Let me see here. I'm going to go through the attendance, Debbie. I took names of everyone that joined via phone. So I'm going to go through the individuals who have joined via phone first. And if I missed anyone, just let me know. And then I'll go to the individuals who have joined via the computer. So I have Jen Talbert, Patience Mead. Can you spell your last name, Patience? I think I misspelled it.
It's S-N-E-E-D.
I put Mead instead of Sneed. Sorry. Thank you.
Yes, ma'am. You're welcome.
Marianne Christian, Heather Vestal, Veronica Oates, Sherry Allen, Kurt Hipple, Benika Knight, and I have Kimberly on here. Kimberly, can you state your last name?
Ladd, L-A-D-D.
Okay, thank you. All right, and then the individuals, did I miss anyone that joined via phone? Okay.
Kirby,
So
who came after Marianne Christian?
I can send this to you. It's Heather Vestal.
Thank you. That's who I missed. Thank you.
Yeah, you're welcome. And then the individuals that have joined via computer, me, Kirby Huffman, that's my maiden name, Kirby Funny with the department, Amber Hampton, Avis Easley, Darren Lehman, Debbie Hillen, Aaron Farrell. Aaron Farrell, is that Mental Health Cooperatives, Aaron Farrell?
It is. Hey, Kirby.
Hey. Cooper or Cal Bryant, Laura Durham, who's joining us in from the location at Tatus. Let me see here.
Kirby, I see a sign that says there's people in the waiting room.
Rama Muhammad just joined.
Good morning, this is Rama. Can anybody hear me?
Yes, welcome, Rama.
Thank you.
Barbara Ann Nelson. And then I see S. Hale. Can you state your name?
It's Stephanie Hale.
Welcome, Stephanie.
Thank you.
All right, Debbie, I'm going to hand it over to you. I think we got everyone.
All right. Good morning again. Sherry sent out the minutes with the agenda. I would entertain a motion to accept the minutes as presented. If I could have a motion.
It's Laura Durham, motion.
Is there a second?
I second the motion.
And that is who, please?
Rama.
Thank you, Rama. Is there any further discussion on the minutes? If not, all right, so now tell me what you were saying about how the vote has to go down, Kirby.
We don't need a vote for minutes, just how we always do a motion or a second. We keep with that.
All in favor signify by saying aye. Opposed likewise. Let's go that way. All right. I am going to try through this modern technology to share screens. And I want needs assessment. Whoops. It's down here in the corner. All right, so I tried to get it all pulled up. Can that be seen?
The
We're
agenda,
looking at
I
the
see.
agenda.
Oh, wait a minute. I got to stop the one and I got to pick up the other one. This is the first time I've shared screens on this one. Did that get, it's not showing you got it. I'm sorry. I want to share. I want to share this one. There. Okay, can you see that one now?
Yes.
All right, so thank you for all the help that we received in doing our needs assessments. I want to just briefly go over with you again a reminder of what we did turn in for Region 5. Amber, I think you ended up with one, if not both. Would you mind going over these for mental health for us, please?
Yeah, so the two different needs that we have, one was to establish a crisis stabilization unit in Region 5. We are currently the only region in Tennessee without a crisis stabilization unit. During the COVID-19 pandemic, Davidson County stopped taking out-of-county referrals, or the number that they could accept decreased, and yeah, they stopped all out of county referrals. And so we submitted this need. We showed what other states were doing as well, just to provide a little bit different spin on it than maybe we have in previous years as well. So that was the adult need that we submitted. And then the one that we submitted for youth was to provide youth mental health first aid to all school staff throughout the state. And so we had our intern finalize this needs assessment for us. So we talked a little bit about the evidence-based to youth mental health first aid and how we could provide that to school staff that may not necessarily have the mental health education to know how to respond in crisis.
All right, and let me see if I can scroll.
Hey, Amber,
Yes.
make sure you give that intern a pat on the back because that was very impressive data.
Awesome. I will. We
say.
actually hired her, so she will be participating in these meetings.
Oh, that is fantastic. I know if Kurt would also agree. We were like, wow.
Yeah,
that was pretty impressive. That was
She
great.
helped us with both of them this go round, and her big thing is policy stuff. So I'm excited to see how that pans out and some of the future stuff that we're going to be doing for the committee as well.
Wow, that's wonderful.
That's great. So thank you both very much. On the substance abuse side, it was to increase funding for medically monitored withdrawal management services for the increasing number of clients that we're seeing. The clients are sicker. This is to offset the cost of running a 24/7 clinic. So the bottom line for this one is the state has done a great job at providing WM dollars to serve the indigent. But I will tell you as of yesterday, so with the funding for Region 5, my average daily census should be about 6 to 7. Yesterday I had 14, which meant I had to use other funding for that. So the need is there. I will give you another, and it's probably not in here. Avis and Kurt, is the fact that when we started MMWM, the only referrals that could feed into that program was mobile crisis, the state institutes, the state-funded mobile crisis centers, law enforcement if they was out on a scene, and the other was ERs. Where we have seen a major uptick is through the ERs, and I'll give you an example. You're aware of the Tennessee Recovery Navigators that we employ. We started with Skyline, Centennial, St. Thomas West, St. Thomas Midtown, and St. Thomas Rutherford, 5 hospitals. We are now, so that's 5. We're now up to 11 hospitals that respond to overdose and alcohol and drug issues in the EDs. So that number has already increased, but we anticipate this next year it going even more. So, and it's stated in here at the time this was done, in the past 8 months, we had served 932 compared to a total of 1482 last year for the full fiscal year. So definitely a need there. The other thing in that also is right now the DEA is still laxed in not requiring a nurse practitioner be on site in order to talk telehealth to a prescriber. And that drove up the cost. I'm not for sure going back how we'll deal with that, but that will definitely decrease the amount of capacity. The beds are there, it's just the cost to support the beds is not there based on the needs of the referrals. I just got through meeting with Mental Health Co-op last week or week before last, and we talked about this program, so a need is definitely there. The other is to increase funding for MAT programs in Region 5. Again, there are a lot of DEA regulations that are associated with telehealth. Right now, they're giving us a break, but to have, I will tell you, we use an LPN. An LPN prepares and gets everything ready. The doctor does the telehealth in front of the client. The nurse is there to do anything extra that the doc wants. But these regulations of requiring that a nurse is not sufficient, that you have to have an advanced nurse practitioner, is driving the cost up for MAT and for detox. So those were the 2 that was put in for that for our region. Any questions on these?
Hey, Debbie, this is Kurt, and I've read it, but remind me, the second need on substance abuse
is to increase
what is the ask there? It's not to ask. Okay, it's about funding, not about the state trying to impact federal regulations. Okay.
Yeah, because of the federal regulations.
Gotcha.
Yes.
Gotcha.
Okay. All right.
Thank you.
No, thank you. All right. So one of the things, the next thing you'll see on the agenda, let's see, I didn't get it pulled up, is Project Rural Recovery. Project Rural Recovery is a project that we get to participate in and excited about it. It is to reach 10 rural counties. 5 of those are in Middle Tennessee and Region 5, and that's what we're going to focus on. I asked Darren Lehman, who is the project director for this for the state, if he would join us today and to talk about it, and I'll fill in with him. But Darren, would you, I pulled your slide up. If you'll just let me know when you're ready for me to advance it, I'll try and advance it.
Okay. Are you able to hear me okay?
We can.
Okay, great. Hi, everyone. Thanks for letting me join your meeting today. So as Debbie said, I'm the project director for Project Rural Recovery with the department. And we have just about 14 slides that we put together. It won't take long to move through them. And so Debbie, do you want me to just get it started with the slides?
Go for it.
Okay. Do you want to pull those up or do you want me to do that?
They should be up, are they not?
No, they're not being shared yet.
Oh, sorry.
That's all right.
It said open the share tray. I did. All right, I guess I wasn't as efficient as I thought I was. Open. Well, you may have to if mine's not going to pull. It's showing on mine, but it.
Okay, let me see if I can do that.
My apologies to everyone.
Let's see. How about that? Are you able to see that?
I cannot. Oh, yes, go ahead. Yes. I can.
Can? Okay, great. All right. Let's see here. And so Debbie, just jump in whenever you want me to stop or have things to say. So the basic overview of what Project Rural Recovery is it's the deployment of 2 mobile health units where we're providing integrated primary care, behavioral health care, and substance abuse services. It's a SAMHSA funded project. It was 5 years. We are in year 2, which began on March 31st. We have a sort of an odd fiscal year, but March 31st was the beginning of year 2. So why integrated care? Well, we believe that it improves patient experience because it offers accessible and affordable integrated care. It's the accessibility portion, so patients can visit in their communities without traveling a large distance. It provides whole care, so it treats multiple issues rather than just one singular focus. We're hoping it reduces the use of the emergency department for patients rather than having them go there for their routine care, that they can actually receive routine care through the mobile health unit. And we really wanted to improve overall health outcomes because patients have more convenient access to care. So it has 2 main goals. Obviously, the main goal here is to treat at least 10 patients per day per mobile health unit. And it's also to provide this model of integrated care. And the hope eventually would be to reproduce this in other parts of Tennessee. Here's here's the scope of services that we're providing. So for primary care, we're doing some screenings, also biometric screenings, and then assessing and treating some basic health issues. And Debbie, you're welcome to jump into this, but I was just going to say some of the primary care issues that I know Buffalo Valley has treated are things, a huge range of concerns from hypertension to oral health issues, which we've seen about 10% of the patients arrive with dental related needs, medication management, medication refills, back pain, cough, sore throats, all sorts of different issues being treated.
You know, and for us, being primarily substance abuse all these years with some co-occurring, what we knew and why this project was of interest to us was that we treat a lot of indigent clients through our system. And there's really no place for them to receive primary care except going through an ER. I often tell the story of Julie, who's the site manager in Lewisburg. Before she came, we had a high incident reports going to the local ER for snotty noses. And I always jokingly say, as a taxpayer, you don't need to go to the ER for a snotty nose. Go to a doc in the box. And she really cut that down. But what this project has done, it has allowed us to be able to get our clients well-rounded care that they would not be able to get. The other thing is, and I'm a little surprised at the numbers that's coming out of Lawrence County. Lawrence County was the first county that really wrapped their arms around this and began making referrals. Lawrence County's home for me, so I kind of know how they think, and that was surprising for me. The other thing that was surprising for me with this is Perry County, who lost their hospital about the time we were kicking this off. There's little to no referrals in Perry County. So what we've learned is while we are promoting we do, and we have a behavioral health specialist on the bus. So behavioral health issues are getting addressed for those who walk in off the streets. But it's really been interesting to see how each county has implemented this within their counties, and we're still working on it. So now with some of the lifting with the COVID stuff, we're going to do a little bit more. But Helen Ross McNabb has the one in East Tennessee, and they're heavy on the behavioral health side of seeing clients, and we're heavy on the behavioral health side of seeing clients mixed with our A&D. But the goal was to put these buses in the communities where the clients were. They know every Tuesday, for example, they can go to Marshall County and that bus is going to be parked in the Walmart shopping center. And we're able to also purchase some meds. So Darren mentioned some hypertension and some of that. We're able to provide some meds along those lines for those services as well.
Yeah. All right. And so another thing to mention here is that we'll continue throughout this project really looking at the services that we're providing in these communities to make sure it's really meeting the patient needs there and make changes as we can. We've already covered this. McNabb Center covers and manages the bus in East Tennessee.
And okay, I was fixing to say, and for Region 5, the bus is actually housed out of Lewis County. It is actually licensed and tagged to 501 Main, which is our main operation there. So it's Lewis, Perry, Wayne, Lawrence, and Marshall are the counties that we're responsible for. And you can see up in the upper east corner, the counties that Helen Ross McNabb covers.
All right. Just a little bit about the mobile health units. They function just like a basic clinic. They have 2 exam rooms, a waiting room, a restroom, though these are not large areas, as you can imagine. Some of our future considerations, we keep talking about telehealth as a way both for the folks on the bus to communicate with specialty providers, but also for patients to be able to be on the bus and communicate or connect with a specialty provider, but also as a way maybe to have patients continue their care if the bus is out of service or if they're unable to travel. So we're looking at that. We continue to look at the flow. As you can imagine, that's a tough space for the teams to really and then
to speak to the front of the bus has a waiting room. The back of the bus has a waiting room that also has a lift for wheelchairs. Well, it's also for people like me that has trouble climbing the steps. So they lift me up and down out of the back with this knee replacement, which is a hoot. And right in the middle is the waiting room and a lab area. There is an area for them to be able to draw blood. They have, they're able to test some components of the blood and get the results back immediately. So you got a driver, you got a nurse practitioner, I got a medical assistant, I got an intake person, and I got a behavioral health person. 5 people. They have their designated little areas on the bus. And when Darren and Deanna came to look at the bus in Lewisburg, you had to do a lot of shifting around. So there's not a lot of room. You have to make a lot of good use of the space, but it is sufficient and it gets the job done, and that was what it was intended for. But it is tight space.
So I'll just move on, Debbie. And here, actually, if you want to just, these are pictures of the Buffalo Valley bus. Do you want to just walk through? Oops, sorry, let me go back. Walk through these from the top left.
That is the way the bus looks. It pulls into the community, and that's what you see. The area he's got the mouse on there, that is the waiting area. You walk up the steps That is the lab area. That's where the all the different machines, the EKGs, the defibrillators, all that is on the bus. You can see in the next picture a different view of that. And then you can see the exam rooms. Got an exam table just like you would walk in any primary care center and get the services done.
And then on the bottom right is the McNabb Center Mobile Health Unit. All right, so to give credit where credit is due, Deanna Day, who's our amazing lead evaluator, has put together some data from year one. So I wanted to share that with you. This is her work, not mine. And so it was pretty exciting. We got a really late start in year one just because of multiple delays and COVID. But the buses saw 326 individuals and provided 452 visits. That's really impressive for a first year of a project that only started a few months ago. 2 out of 3 were male. 3 out of 4 had experienced trauma. This is all data reported by patients. 4 out of 5 are unemployed. And then 55% have spent most of their past month in detox, substance abuse treatment facility, correctional facility, or are homeless. And a little more. So, I did not, sorry about that. So 26% were requiring behavioral health and or substance use services. 24% were requiring medication management, and then 50% were needing some primary care related service. The image on the right, the map, so the orange locations are the locations of the bus. And then the blue are actually where the patients are traveling from or where they consider their home county. And so you can see that they're actually, we're capturing patients from a lot of different counties, which in the future may help us if we're able to expand. This would be good data for us to be able to see where the need would be.
And to go, if you'll go back that one, you see a quote there. This was from one of the clients that was seen on the bus. And they were, when you talk with any of them, they're extremely grateful for the opportunity to get their health needs met. They know that their health has been greatly impacted by their substance abuse use and by trauma and just lack of care. And they're grateful to be able to come. And so this was just a quote that was made from a couple of them.
And I will say when I visited the bus, it was really, really amazing to hear one of the common themes from the patients was how grateful they are to receive care without judgment. And I think that's a huge shout out to the team that Debbie has assembled for this, that they're there providing care regardless. And I think that's a huge important piece of care for patients. So a little more data. Total visits by county. You can see Lewis County has by far the most visits, followed by Marshall County. McNabb Center had a little bit later of a start, and so their volumes are continuing to ramp up. Fridays are, sorry. Oh. Fridays are by far the most popular day for services, followed by Tuesdays. And just some additional resources. We have a website that has all of the locations, the schedule, the phone numbers, if that is of use. And then there's contact information for both Debbie and Shelley with the McNabb Center. There's my contact information as well. And I think that's all I have. Debbie, anything to add or you want me to speak to?
No, what I'd like to do is to try to bring, if I can, if you'll unshare, and I'd like to see if I can share. Sherry, did our flyer get out to everyone?
Yes, ma'am.
Okay. I don't know why I cannot, what the magic button is here. Close the share thing. Open it. Well, because I'm not crafty.
Hey, Debbie Davis, you can try this. Try just opening the document. Is it a PDF?
It's open.
For Word document? Okay, and then it's go to your desktop. See if you can pull it up from your desktop while it's open. That may help. Of course, I'm not the expert. I'm just
yeah.
That's what worked for me. That's what I had to do. There you go.
There you go. Okay. I don't know what I did, but okay. Thank you, Avis. This is a card. McNabb has one very similar. We made it where it could fit in a pocket at any DHS health department. We've worked with the health departments. We've reached out to DHS, DCS, and this is just, and we're going to start doing some HIV, some more stuff, hepatitis C. And here are the days of the, sorry, I forgot to silence it. Here are the days where it's at in our respective counties. Wayne County, Monday, Tuesday, Marshall, Wednesday and Perry, Lawrenceburg on Thursday, and Lewis on Friday. You know, it was a little difficult getting this up and running right in the middle of a pandemic. But I will say that I think that's been a barrier to the starting, plus having a lot of things just operational wise. And one of the things that Shelley and I, who is the project person in East Tennessee, we both said we don't know what we don't know. And together, we put our brains together with Darren and Deanna and we try to come, and Jessica, to try to come up with, oh, I didn't think about that. Oh, I didn't think about that, because physical health is totally foreign to McNabb and to Buffalo Valley. So to have a staff that can actually help us to understand is a good thing. And so it's been a learning experience, and we're very grateful for it. And so any questions on Project Rural Recovery? If you know of community providers in Region 5 that we need to reach out to, please let us know. For the TennCare representatives on this video, we'd love to try to figure out how to partner with you in order to get the word out. And, you know, hopefully one day we'll be able to serve the TennCare clients and as well. So Darren and I'll entertain any questions that you might have.
Can you share the presentation with the members? I'd like to look at it and study it a bit more.
No, we're not going to let you study anything, Cooper. Yes, and if I'm not mistaken, we'll be presenting this at the statewide planning council also.
Yep. And Debbie, I have an updated version of the slide deck before you send them out. I just found a couple of corrections.
All right. Any other questions or comments?
Yeah, hi, this is Jen Talbert with Bureau of Health. And I would love to be able to get some of the cards to put in our lobby of our Wayne County clinic and our Lawrence County clinic, because 1 in 5 of our patients on average are uninsured. And I think that this could be a great resource for them, Debbie. So
can you make sure we have your contact information and we'll get you some?
I will do that. Thank you so much.
No, thank you very much.
Hey, Debbie, this is Kimberly Ladd. I just wanted to say great job. This is obviously a much needed and valued resource for our communities. I know it couldn't have been easy during a pandemic, but y'all got it done. So this is really great. I'm excited to share it. Thanks so much.
Now, you're out of Murray County, right?
I am. Mm-hmm.
All right. So just for your information, if you have someone that needs those services, they can go to either Lewis County or to Marshall County.
And they often do. You know, we find that that's all, you know, the case. You know, people won't mind, you know, often traveling like that. So I do want to share it regardless. Absolutely.
Okay. All right. I'm going to go back here and see if I can find the agenda. All right. Oh, next subject. Sherry has notified me at the end of last week that she is resigning, which would mean she's also resigning from the Region 5 secretary thing. So on this call, I would like to acknowledge Sherry and all the work she has done. She made my part easy when it came to Region 5. And she made sure all the notices got out, and she made sure the minutes, and she kept me in line, and especially when Kirby and Avis couldn't find me, Sherry always found me.
That's a full-time job.
So Sherry, on behalf of Region 5, as well as myself, I want to thank you for all the hours and the attention and the details that you put in to making sure Region 5 operated like it did. So kudos to you. Look forward to hearing what your new adventures are going to be. But again, many thanks. Anyone else?
Thank you, Miss Debbie.
Hi, Debbie. This is Avis, and hi, Sherry. I just wanted to say a couple of things because I have been working with Debbie for a long time now. I've lost count, Debbie, on the number of years, but in addition to that, I've been working with Sherry off and on, and I just wanted to say throughout the Region 5 timeframe that Debbie has been chair, vice chair, a member, all the above. When, as Debbie said, when we found ourselves in a situation where we didn't have a secretary or somebody resigned midterm because of new employment, transfer, whatever, Sherry stepped up to the plate via Debbie, because of course Debbie had to give her permission to do that, allow her to do that along with her regular job responsibilities there at Buffalo Valley. And Sherry was absolutely wonderful, came in with a smile. She's leaving with a smile. Every time I was there physically at a meeting, she would smile, give me a hug. And I'm going to miss her terribly because of the working relationship that we have. And I just enjoy working with her. I don't get to work with her as much now because Kirby is here with us and doing a fabulous job. But from time to time, I get to drop Sherry a note or intervene in an email that I was copied on just to say hi. So Sherry, we're going to miss you. Wish you the best in your future endeavors. And we'll always remember you. You'll never be forgotten. So we'll miss you. And thanks for all that you've done.
Thank you, Amy. That's so sweet. Y'all make me cry, and I'm not a crier, but I love everybody here. And kind of just reflected from me. Can I throw out that Kirby has little Dylan, and I don't think I've gotten to see a picture lately of Miss Little Dylan, or does Region 5 know about that?
She said that if we were lucky, that we might get to see her at the end.
Oh, good. Okay.
I'll send you some pictures too, Sherry.
I love you all. Okay.
With that being said, we do need to fill the secretary position. And Kirby, between Kirby and Avis, keep me in line. We would open the floor up for nominations, or somebody could sweetly volunteer. But the floor is open for nominations for this position. So I'll open the floor.
And if anyone has any questions about what it entails, I'll be happy to answer that as well.
At this point, I don't have another staff member that I can devote to this project at this point in time. I actually hadn't done that much thinking with regard, is there someone else that I could bring with me? But that leads to the issue, though. You can't always depend that I can find another staff member that I can devote to doing what Sherry's done. So we really, within the region, need to find someone who would fill that vacancy.
And there might be someone interested that's just not on the call too. So if there aren't any nominations today or anything like that, we can also open it up to the rest of the council via email, or if anybody on the call can think of anyone that even they work with that's been interested in becoming a member, or, any suggestions, we're open to that as well. There's a few regions that are going through some transition right now as well, Debbie.
Oh, good.
Yeah.
Good. That's good news. All
yeah.
Right. We'll send something out with regard to that, and see what comes up there. But please really give some consideration. While serving as an officer on the Planning Council, I'll tell you, from my perspective, I view it as an honor and a privilege that I get to do, and I get to have input in what's going on at the state level. And it doesn't matter what position that it is, whether it's chair, vice chair, secretary, whatever it is. You get to have a voice, and you get to know what's going on. Time commitment? Yeah, it's a time commitment. But it's an important time commitment. I know that once a quarter on this first Thursday, it's blocked on my calendar, year in and year out. And I make that time. And the only way we can increase our membership and we can continue to have a voice is if all of our members feel that commitment, and that it's just not something you got to do, because it's not. You get to have a voice. So we'll send something out that lends to seeing if we can find someone to serve in the secretary role. Again, Sherry, thank you very much from the bottom of my heart, because you actually ran Region 5 for me. I just showed up and chaired the meetings. So thank you very much. You will be hard to replace for this. I assure you of that.
Thank you, Debbie.
Kirby, the department updates.
Okay, let me see here. All right, so just a few updates since we last met in February. The February report, 3-year plan, year 2 FY21 has been completed and it's been shared with regional council leadership. If you're interested in viewing this document, please contact Debbie or Amber and they can get a copy of that to you. The department would like to encourage the regional planning and policy councils to identify matters affecting individuals with mental illness, substance use issues, and/or co-occurring disorders that may require legislative attention in the 2022 legislative session. Regional councils may use their 2021 needs assessments to help generate ideas for legislative proposals. Please utilize the legislative proposal process. This was shared via email with Debbie, Amber, and Sherry a few weeks ago to complete your legislative proposals. Legislative proposals should be sent to me by close of business on May 17th. Sherry, are you the legislative subcommittee chair of Region 5? I know you're the chair of the statewide legislative committee.
Are you talking to me?
Yeah.
Yes.
Not every regional council has a legislative subcommittee. It's really just, it's not a requirement. Some regional councils have them, some don't. But if you have any questions, I would reach out to Debbie.
And if I can intersect there just a little bit, Kirby, is if there are some legislative issues, and when we get, well, I'll let you finish, and then when we hit legislative committee, I'll bring Kurt in some. So go ahead. I'm sorry, Kirby.
I think Kurt signed off.
Kurt. Oh, did he? Okay.
Yeah, but I might be able to answer some questions.
Well, I know sometimes it becomes a question: is it a legislative issue or is it a? He had another
budget action. Yeah.
Yeah. And it's okay. We just put it all down. And they actually help us sort through it. So if there's anything that, whether you think it's a law change or it's a project direction change or it's a budget type change, please get those to me. And, May 17th is right around the corner.
Also, Debbie, as the region prepared or identified needs assessment along the way, if there is one of the needs assessments that this council has put together already and submitted it to Kirby, if there's any legislation that could come out of that, that's another way of looking at it and another way to streamline that process too. So that could be another thought or suggestion.
Okay.
For a proposal or recommendation for a rule change or something of that nature.
Okay. Anything else, Kirby?
Yes. These next two updates, more information will be coming out about these in the near future, but I just want you to be made aware of them. The department will receive an additional $15 million from SAMHSA through the Community Mental Health Services Block Grant and $30 million for the Substance Abuse Prevention and Treatment Block Grant to assist in the response to the COVID-19 pandemic. States may use this supplemental COVID-19 relief funding to respond to needs and gaps due to the ongoing COVID-19 pandemic. The department will also receive an additional $687,000 set aside from the Mental Health Block Grant allocation to support evidence-based crisis systems. The 5% set aside will be used for evidence-based crisis care programs addressing the needs of individuals with serious mental illness and children with serious mental and emotional disturbances. Funds may be used to address some or all of a set of core crisis care elements, including centrally deployed 24/7 mobile crisis units, short-term residential crisis stabilization beds, evidence-based protocols for delivering services to individuals with suicide risk, and regional or statewide crisis call centers coordinating in real time. And like I said, more information will be coming out about those 2 updates in the near future. Tennessee's emotional support line for pandemic stress is adding a new method for people to reach out for help. The free and confidential line now has the capability to offer assistance via text message. Tennessee healthcare workers, first responders, and all Tennesseans working in education, including educators and district and school administrators and staff, dealing with feelings of stress, anxiety, sadness, or depression related to work, can now call or text the emotional support line at 888-642-7886 between the hours of 6 a.m. and 10 p.m. Central Time daily. Specially trained mental health professionals who answer calls or respond to texts through the line can provide emotional support through active listening, help identify and address basic needs, and reference tools for managing stress and making a plan for self-care. And when I gave this update yesterday, Mary Linden with TADIS said this also includes police officers, law enforcement as well. And that is all the updates I have.
Okay, thank you, Kirby. Any questions for Kirby? Okay. We'll go into committees.
Hey, Miss Debbie.
Yes.
We've got a big announcement we have for the Children's Committee. Kimberly Ladd has agreed to chair it. I know. Yay! It's great. Thank you, Kimberly.
Yay!
Yeah, you made my day.
Well, Kimberly made our day.
Yeah, well, that's what I meant. Yay! We're excited. Or I am.
Is Kimberly still on here? Because she was earlier.
Yes, ma'am, I'm here.
Oh, bless you. Anything you want to say to us?
Well, I just caught half of what you said, but I think I know what you're talking about.
She said you volunteered to be the Children's Committee chair.
I did, and I'm so excited. I really appreciate that vote of confidence, and I look forward to working with y'all closer.
All right. Kirby, if you can make sure she knows when the statewide Children Committee meets.
Sure, I'll reach out to her after this and add her to the committee listing. Sure.
Thank you very much. Sherry, do you have any good news about the Adult Committee?
No, unfortunately, I wish.
Shucks, it was worth a try.
Absolutely.
Yeah, you know, hey, I'll take one of the 2 right now. I'll do that. All right, so as you heard earlier, the legislative proposals are due May 17th. We'll resend some information out about that. It doesn't matter what you ask for. It really doesn't, because they sort through it. And it's just, again, having that voice. I need to actually put some thought into that. And I'll go back. I'm not sure we had one last year. Kirby, do you remember your Avis? Remember?
I think last year was just regions 2 and 4, I believe. There weren't very many submitted last year.
Yeah.
The year before region 5 submitted, though.
I think sometimes we get confused because that comes right on the heel of the needs assessment. Please do some we'll send out the needs assessments again. Look there. Is there any legislative stuff that we need to put in there? And we'll go from there. Coalitions on the line, because I can't see your faces. All right. Any announcements? I know Cooper's got to have something. Cooper always has an announcement.
Well, I'm here. And we're still telecommuting. We're not going to the meetings in person. We're still working from home, all of us. So we'll continue until I think this disease is under control. I'm hoping by the fall we can attend meetings properly, or conferences and health fairs. I miss everybody very badly. But in the meantime, if there's any events coming up, any sponsorship needs, please don't hesitate to contact me. I know everything is online, but we're still supporting the community.
Thank you. Lawanda, I see you are muted, but anything from AmeriGroup? I do see her, don't I? She pops up on my screen, but
she's here. Lawanda, you might be muted. You might be on mute.
She may not want to talk to either one of us, Kirby.
I'm used to that.
Me too. So yeah, no, Lawanda's usually pretty good. But is Blue Care or Blue Cross on the line? Are there any announcements? Well, I'll throw out a couple. I need some LPNs. I need some CPRSs. And I need a Sherry replacement. Aww. So I'll throw my needs out there. But Buffalo Valley is still looking for some nurses for detox. And I'm still always looking for CPRSs. And
hey, Debbie.
Yeah.
Debbie, so I'm going to be on the Consumer Advisory Board meeting tomorrow. Do you want me to advertise that you're looking for CPRSs?
Please.
Okay.
Hey, and I'll tell you one area that I really need one is I need one in Lawrence County.
Lawrence County?
Yeah, they can live in Giles, Murray, but I need one. Cooper, you're on mute. I see your mouth. I see your mouth going, but I didn't hear anything.
Okay, I'll make an announcement then tomorrow at the meeting.
So
and I'll email the chair your contact information, Debbie.
That would be great. Thank you very much. Sherry's reached out to Michelle and Em, and what we found is that, and correct me if I'm wrong, Sherry, but CPRS is down in the southern part of Tennessee are slim and few to come between.
That is true. And then Kirby, the thing that would be wonderful if you announced is that they don't have to be a CPRS yet, but if they're eligible to be a CPRS, then we could help them gain that CPRS certification. I think that's one of the that we have.
And and I know because there's kind of, especially with COVID, there's a long waiting list for certification because, it's hard to do as many in-person trainings and things right now. So I think that would be helpful.
The other thing for the Lawrence County project, and all right, so let's be honest, it doesn't matter to me, but it does matter to the funders of that particular project that I'm trying to staff up down there. They can't be actively on probation and should have been off of probation at least 1 year. Now, that don't bother me. I'm used to that kind of stuff, but it's only for that specific project that is a stipulation. Buffalo Valley and CPRS says otherwise, we're good with you. Just that funder requires that you have to have been off probation for at least 1 year. But help, please help. Other announcements. Anybody got anything going on? The special new. Amber, anything from you?
Nothing new on our end.
All right. Well, we're early. Kirby, there's no stipulation how long this that we have to do this, is it?
No, if you need to end early, if you've
Is there anything else?
finished.
The floor is open.
Hey, Debbie, this is Sharon
Yes.
Biggs with Mental Health Cooperative.
Yes.
Hey, I just wanted to let the group know that our criminal justice liaison services have expanded quite a bit. Unfortunately, that happened, of course, right before COVID. So we're still trying to get our grounding in some of our newer counties, but we do currently cover several Region 4 areas. So we have Rutherford County, Cannon County, Coffee County, Marshall, Moore, Marion County, Sumner, Robertson, Cheatham, and we're working on Humphreys and Houston also. So we work with individuals who, of course, have mental illness or co-occurring substance use disorders, and are involved in the criminal justice system, either in jail or they could be out on probation, just needing linkage to resources, whether it's regarding healthcare, financial resources, general support. So if anybody has anyone that needs any help or ever have any questions, just feel free to reach out to me, and I can get you connected with the appropriate liaison.
Thank you very much. Sherry, did you get those counties? Or would you email those counties to us so we make sure we get them correct?
Yes, I can do that.
Thank you.
You're welcome.
Anything else? Hearing nothing, I will entertain a motion to adjourn.
Can I make a motion?
Can she, Kirby?
I think it has to be a voting member.
It has to be a voting member.
Yeah. Sorry, Kubra.
They won't let me help you.
Is there a motion to adjourn?
This is Amber. I'll make a motion.
Thank you. Is there a second?
Laura Durham, second.
Thank you. I have a saying is if there's no objections, vote with your feet. I'm not sure where you'd go except to your next room, except for Laura, and Laura go back to her office probably. But I thank all of you very, very much for your participation this morning. Kimberly, excited to have you to chair the Children's Committee. Best I can recap, we're going to send out more on the legislative request. We'll send out a request looking for secretary nominations as well as the adult committee chairperson. And our next meeting will be August the 5th. We'll let you know how and when. Thank you very much. And this meeting is adjourned.
Thank you. Bye.
Bye, everybody.
Bye.
Bye. Thanks, Debbie. Bye-bye.
Thank you.